Hello everyone, I am Teodóra Filipov. Let me present you the progress of my project in different fields of radiology. My vision is to lower patient discomfort by offering minimally invasive treatment options and less invasive diagnostic tools, and I would like to reach this vision with my mission to research novel techniques and stay up to date in the field. As an overview of my two projects, the topics are quite different. The first one is about detecting fibrosis in kidney transplanted patients, and the second one is about treating fibroadenomas of the breast. Let me start with my first one, meta-analysis. As already mentioned, the topic is fibrosis and detection of dysfunction in kidney transplants. Let me tell you a bit about the background. So it is known that all processes of dysfunction in kidneys eventually lead to a common endpoint, that is fibrosis. So interstitial fibrosis and tubular atrophy are the #1 cause of allograft loss. So it is essential to check up on these patients regularly. And currently, the gold standard method for this is biopsy. And although they are considered safe, they still hold some risks. The major complications being AV fistula, bleeding, or even graft loss. So an emerging new modality is shear wave elastography to be able to detect fibrosis in these kidneys. And with the help of non-invasiveness and B-mode ultrasound guidance, it could be of big help in the follow-up of these patients. So the basics of our meta-analysis is to see if there is correlation between fibrosis and several dysfunction parameters. We conducted a systematic search in October last year, and out of 6,000 articles, we selected 12 to be included in our work. And with one extra record added later on through an external source, we totaled 13 articles to be included into our meta-analysis. Let's see the results. So about the results, I have to say that we asked for subgroup analysis according to the correlation calculation used, because these are quite different things. Pearson correlation assumes a linear relationship between these between two variables, and Sperman correlation evaluates a monotonic relationship that is not linear. In every article, the population was quite heterogeneous regarding age and gender, and we also had a pediatric study in the pool. But all in all, our results show a pretty conclusive moderate correlation between elastography and fibrosis according to biopsy results. Our second outcome was comparing elastography to resistivity index. RI is a calculated flow parameter. Is derived from, it is assessed by Doppler ultrasound. And we can see here that the results are very heterogeneous, and we can assume that there is maybe no connection between these two parameters. We found a weak positive correlation. Blood creatinine level is an important indicator of kidney function, and Here we can see a kind of also heterogeneous results. Some of these articles included only stable patients, some included patients with dysfunction, and there was one article only that compared a stable group to a dysfunction group, so the heterogeneity can be due to that. But at the end, we found a moderate positive correlation between these two parameters. As the strength for meta-analysis, we can say that this is the first one comparing several dysfunction parameters to shear wave elastography, and but we also have some limitations, being the very limited number of articles, and we were unable to carry out a subgroup analysis because data was not available in the papers. As a conclusion, we can say that shear wave elastography correlates positively with biopsy results in the kidney transplanted population, but this correlation is not strong enough, and we don't really have enough evidence to support SWE over biopsies. It would be important to research the sensibility and specificity of shear wave elastography to detect dysfunction and fibrosis. But because of the superficial location of transplant kidneys, this could be a very useful tool to use in the future. After a round of inquiry emails, I am happy to say that we have submitted our article to the Journal of the American Society of Nephrology. Yes, my second project is a protocol for an interventional trial. The background of this research is fibroadenomas, or common breast lesions, presenting mainly in the younger generation. And although these are considered benign and have a very small chance of turning malignant, the traditional treatment is a surgical excision, but that can be a problem for women presenting with multiplex or even bilateral fibroadenomas. So fortunately, a minimally invasive approach is emerging, and which is fast and painless and can be delivered in an outpatient setting. So we want to see if this method is really that effective in our clinical practice here in Hungary. So, but what is cryoablation? This is a new method that uses a disposable cryoprobe, which is cooled by liquid nitrogen that forms an ice ball around the lesion. And it is cooled down to lethal degrees, and this results in cell death and cell lysis over the time and also instantly. Our inclusion criteria are listed above. Women of above the age of 18. These lesions have to be core biopsy proven, and the largest diameter of 6 centimeters. This is also due to this procedure being a fast procedure. If we treated bigger lesions, the times of the procedures would prolong very much, which would be which wouldn't be very good. Oh, sorry. Yes, our outcomes, our main outcome is, of course, the eradication and reduction of these lesions. And we will also assess several clinical secondary outcomes. Right now, we have submitted the paperwork for the ethical approval, and we are waiting for that and continuing work with the registration. So to sum up, Our first project is already submitted, and we want to submit the protocol in September or October. And let me end my presentation with the wise words of Peter Hegyi, that hope is not a strategy. Thank you.
And congratulations to your first project. I mean, maybe this is not the end, because then you have to fight, I mean, during the review process. And so, so how did you actually discuss this heterogeneity? I mean, is this primary? Because, I mean, you said that, well, different methodologies and so, but sometimes it appears actually from, not sometimes, actually quite frequently, it could happen that you are the one who figure out that some of the methodologies are not good enough, while others are good.
Well, of course, all of these articles, that is a great limitation of our work, that all of these articles use different ultrasound machines and ultrasound protocols, and also there were very little information about patients in the articles, so we couldn't really assess the reasons of heterogeneity. We were just guessing, actually.